Good morning, and thank you to the 2026 Multidisciplinary Head and Neck Cancer Symposium Steering Committee and the American Society for Radiation Oncology for inviting me to be here this morning. I want to begin by saying how profoundly grateful I am to be here with you today, not simply as a speaker, but as a person who is able to stand at the podium, to speak clearly, to enunciate my words, and to share my experience with you. Today, every word I speak is a quiet victory. It's a privilege to address a room filled with professionals who have dedicated their lives to healing, to restoring function, to preserving dignity, and to walking alongside patients in their most vulnerable moments. I stand before you not only as someone who lived the experience, but someone who has witnessed firsthand the extraordinary impact of the medical care delivered with both skill and compassion. Illness and recovery have a way of reshaping your identity. They force you to confront the fragility of abilities you once took for granted. Speech, mobility, memory, independence. When something as fundamental as communication is compromised, you quickly realize that speech is not merely sound. It is agency, it's connection, it's autonomy, it's humanity expressed outward. In my recovery from surgery, my ability to deliver a clear consonant, a sentence, a steady breath, what might seem clinically incremental can feel existentially monumental to a patient. And that perspective is something I hope to offer you today. A reminder that behind every assessment, every collaboration, every imaging result, there is a person recalibrating their sense of self. Your work extends beyond physiology. You restore confidence. You rebuild identity. You give people back their voice, sometimes literally. As clinicians and researchers, you are trained to focus on outcomes, metrics, and evidence-based practice. These are essential. I encourage you to remember that the emotional architecture surrounding recovery and the fear of not returning to baseline. Standing here now, speaking with clarity, I'm reminded that medicine is not only about saving lives, it's about restoring the texture of living, conversations at a dinner table, reading out loud, answering a grandchild's question, expressing love, or advocating for oneself. So today I offer my gratitude for your training, your discipline, your long hours, your research, and your humanity. Because of professionals like you, patients like me are not only able to survive, but to return and participate and contribute. In April of 2023, I identified a lump, what looked like a blister on my right rear palate. I had scheduled a dental cleaning and an x-ray, which then resulted in a root canal. I shared with the dentist as to my concerns about a bump or this blister that was in my mouth. He thought it was an infection and attempted to lance to drain the blister. Upon my follow-up 2 weeks later, the blister had returned. The dentist then referred me to an oral surgeon. The oral surgeon examined me, and the recommendation was to have a punch biopsy. His diagnosis that this was something less threatening, and he attempted to clean the area, removing what in his thoughts were something that was benign. 2 weeks later, the biopsy returned with the lab results of secretory carcinoma, and I was referred to a surgeon in the Pacific Northwest. Upon scheduling my first visit, based upon laboratory results of this biopsy, the surgeon's diagnosis was best described as deafening. It was determined that I should be prepared for what could be multiple surgeries and an outcome resulting with limited capacity compared to my then current life. I was scheduled for an MRI at a local radiology center, and while these results were a little more uplifting, it was my hope that the surgery would be less invasive than the initial plan that was put forth by the surgeon. I was scheduled for surgery on October 23rd. On October 27th of 2023, I was called in early for surgery to be on the 29th. And I left that day on a 3.5-hour drive to the area where I would be admitted the following morning for surgery. Upon admission, I was administered an IV, later introduced to an anesthesiologist who advised me that I should be prepared for approximately a 3 or 4 hour surgery. Within an hour or so, a nurse provided me with a disclosure to sign describing a procedure that was removing possible bone and soft tissue in my oral cavity. I was concerned about the bone loss and what this would mean for my recovery. Another 2 hours went by. The nurse then returned with a second disclosure for me to execute. This disclosure described that surgery would result in an opening that required the deficit to be repaired by material from what was anticipated to be from my wrist, and to be prepared for both wounds in my mouth and my wrist area. An hour or so later, I was advised that my surgeon that was involved with a procedure earlier that day had run into complications and that my surgery would be delayed to later in the day, and I was to remain in a pre-surgical staging area. An hour later, I was presented then with a third disclosure that the proposed procedure would require greater repair such that the materials would be taken from my thigh as well as my wrist. I can remember vividly the fear that grew inside me, thinking that this deficit in my mouth was going to be so large that I would have 2 additional wounds to recover from. I had no idea how the plan would be executed. The end of the day grew quickly, and I was then visited by a surgeon. I was expressing my concerns about the multiple plans and the new solution to me of materials being harvested from both my wrist and my thighs. And I expressed my concerns that while there's not hair on my head, there is hair on my wrists and my thighs, and these parts of my bodies, and asked if this would continue to exist now in my mouth. One of the options was to then do a follow-up laser procedure to help resolve that. But then the alternate solution was then presented to utilize cadaver skin to repair the deficit. But this could result in the repair grafts possibly not taking, and to be prepared for multiple follow-on surgeries. As a result of my concerns and the lateness of the evening, my surgeon discharged me for being understandably unprepared for the outcome. Inside, I felt abandoned. I had made no progress towards regaining health, and I didn't at that moment have a path forward. I knew at this moment that I needed a new plan. I immediately began research not only for a skillful surgeon who could eliminate cancer, but who would understand my concerns for what life would look like after the invasiveness of the cancer-removing procedure. God answered my prayers, and in my search, I found my angel. I discovered an internationally recognized surgeon scientist, Dr. Mai St. John. I read about her career reflecting a blend of clinical mastery, scientific innovation, and visionary leadership. I also learned that she had a daily schedule that every minute of the day is accounted for with the greatest of efficiency. I presented my circumstances via email and followed up with calls to what can be best described as a clockwork of a very efficient support team, nurses and staff that coordinated my initial examination. The resulting initial examinations, including scheduling of a PET CT and a scan that had not been requested or completed in my previous care. This scan was coordinated with great speed and correlation to another simultaneous meeting for an additional evaluation. I was referred to a partnering surgeon, Dr. Reza Jarahe, who was a well-regarded craniofacial surgeon. I read and understood that Dr. Jarahe is recognized both nationally and internationally as a leader in his field. His expertise is in caring for craniofacial patients and involved with extensive reconstructive surgery of the head and neck to include cleft palate, soft tissue, and bone tumor reconstruction, and many others. These coordinated efforts by Dr. St. John and her staff were also in collaboration with Dr. Jarahe and his staff. These efforts were coordinated with me living some 850 miles away from the point of care. It was done so with such great care to limit the number of flights or drives necessary to complete my evaluations, along with additional PET CT scans and labs. What I learned is that my care was a journey, one that could either feel coordinated and reassuring or fragmented and overwhelming. It's this doctor, nurse, and admin team who determine which those experiences the patients have. For me, the healthcare system is unfamiliar. It's complex, it's intimidating. Multiple tests, consultations, preoperative requirements, insurance authorizations, scheduling constraints, all of these moving parts can quickly become a sense of anxiety. When coordination falters, patients feel lost. When communications is unclear, we feel unsafe. Having two distinctively different experiences, my second experience transformed this complexity into clarity. They ensured diagnostic testing was scheduled in the proper sequence, where results were confirmed and available before appointments, minimizing delays and anticipating logistical barriers. They aligned surgeon availability, anesthesia clearance, imaging, labs. All these follow-ups were made into a cohesive plan. This may be considered workflow management, but from my perspective, it felt like being cared for. My confidence in having a positive outcome grew immensely that day. In addition to the scan, the biopsy materials were then transferred to a new lab, and the results were then adjusted or corrected to MEC, mucoepidermoid carcinoma. A well-coordinated call, a timely reminder, or proactive clarification, these small actions significantly reduce a patient's stress. To me, both my surgeons, nursing, and admin teams, they weren't support roles. They are guides or advocates and anchors throughout the care continuum. In my evaluation with both Dr. St. John and Dr. Jerhag, were coordinated for a plan for surgery, where I was presented with plans A, B, and C. They were all innovative, all minimally invasive, and effective ways of solving whatever deficiency would be created in the removal of the materials necessary to guide me back to health. My surgery date was scheduled for December 22nd. I was coordinated and accelerated not only for the benefit of my health, but also in saving me the burden of additional insurance deductibles so as not to have my surgery date move into the new year. No grafts outside of my mouth were necessary to repair the deficit created by the cancer removal procedure. I drove home 2 days later, December 24th, with the knowledge that my margins were clear and that I was on the path of recovery and health. There are moments in life when words feel too small for what we carry inside. This is one of those moments. Because what I have been given is not simply successful surgery. It's not merely restored health. What I have been given is time, presence, the ability to live fully again. Two remarkable surgeons working not just with skill, but in true collaboration changed the course of my life. Individually, each of them performs at the highest level of care. Their training, their discipline, and their expertise are extraordinary. But what moved me the most is what happened when their talents came together. A shared commitment to excellence and to the person on the table, me. In an era where medicine can sometimes feel transactional, they demonstrated what true healing looks like. Communication, trust, humility, and teamwork. They combined their knowledge, challenged each other in the best of possible ways, and aligned around one goal, my recovery. Because of that collaboration, I stand here today restored. Because of their precision, I can wake up without fear. Because of their dedication, I returned to functioning at a level that I had feared would be lost forever. But more than anything, because of them, I can walk into my home and wrap my arms around my wife, look into their eyes of my children, scoop up my grandchildren and kiss them. I can tell them out loud and without hesitation how deeply I love them. This is the true measure of what you have done. You didn't just repair a body. You restored a husband. You strengthened a father. You gave back a grandfather, and you returned me to the people who are my greatest joy. To both you and your amazing teams, thank you for your mastery. Thank you for your partnership. Thank you for seeing me not as a case, but as a whole person with a family waiting for me. Your collaboration is a model of what healthcare should be at its very best. From the deepest place in my heart, thank you.